Good evening. Today is July 31st, 2019. It is 5:30. As a quorum of the board is in attendance, I would like to call the order of the public hearing of the Central Health Board of Managers. The public hearing concerns the healthcare provider participation program established by the board to enable the district to collect mandatory payments from institutional healthcare providers that will support the provisions of healthcare to district residents, and specifically the amount of any mandatory payments that the board intends to acquire and the permissible uses of the revenue generated from these payments. I will begin with staff presentation by Katie Colburn. Thanks, Katie.
Thank you. Good evening, everyone. I'm Katie Coburn, and want to just open up this public hearing with some brief information on our local provider participation program. As you all know, Chapter 298E of the Texas Health and Safety Code was created by Senate Bill 1350, passed in this past legislative session, authorizing the Central Health Board. I can stand. I'm happy to stand. Can y'all hear me better now?
Some oil.
How's that?
Better.
This is what I've always wanted. So to continue, the Senate Bill 1350 created Chapter 298E of the Texas Health and Safety Code, granting the authority to the Central Health Board of Managers to create a healthcare provider participation program. And that program also includes a local provider participation fund, whose purpose is to collect mandatory payments from Travis County inpatient hospitals or hospitals that provide inpatient services, and use that revenue as the local match to draw down federal funds in supplemental payment programs for hospitals. The public hearing tonight is to hear public comment on the proposed mandatory payment rate, which is proposed at 1.1% of the net patient revenue of Travis County hospitals, generating approximately $35 million for this initial payment rate. The setting of the rate is your decision as the board. Central Health then, as the LPPF administrator, will collect those funds in a fiduciary capacity and use those for the purposes laid out in the legislation, which is to complete those intergovernmental transfers. So I will leave it there and make the floor available for public comments.
Thank you, Katie. Lisa?
Hi, good evening. My name is Anais Cruz, Program Manager, Communications and Community Engagement at Central Health. We're going to kick off our public hearing with our process and guidelines. For the purpose of citizens' communication and public hearings held during the course of a Board of Managers meeting, the board will follow the guidelines set out below. Number 1, any person may speak during citizens' communication portion of any Central Health Board of Managers meeting at which citizens' communication appears on the agenda and during any public hearing that is posted as such. Number 2, in advance of speaking, an individual must complete a sign-in sheet that includes the person's name, address, and organization being represented, if applicable. At the individual's option, he or she may provide a telephone number and email address. Number 3, the chairperson or presiding officer will call speakers in the order in which they are listed on the sign-in sheet. Number 4, each speaker has a limit of 3 minutes. Number 5, each speaker may address the board only one time during any particular citizen's communication or the particular public hearing. Number 6, a speaker may not donate his or her 3 minutes or any other part thereof to any other speaker. Number 7, a speaker does not have the right to speak if he or she signs in citizens' communication after the public hearing is closed. The hearing will be closed once the last individual who has signed in has spoken. Number 8, depending on the number of persons wishing to speak, the chairperson, in his or her discretion, impose additional procedural guidelines on the time and or manner of speaker's presentation to ensure the efficient and effective conduct of the meeting.
So I need to read this into the record because I stepped away for a minute. We have now reached the time to receive public comment on the proposed fiscal year 2019 mandatory payment rate for Travis County institutional healthcare providers and the permissible use permissible uses of the revenue generated by these late fees. And Ms. Cruz already read our guidelines.
And I will call up our first speaker, Carlos Zaffarini with HCB.
Good afternoon, board members. My name is Carlos Zaffarini, here speaking on behalf, or representing Ascension, Texas, and Baylor Scott and White and Universal Health in their capacity of behavioral health. What we are excited about is the opportunity that Mike and Jeff and the board were able to do in supporting an LPPF. We think it's critical for the community, and we're so thankful for the leadership that all of you put forth in getting something this important done for the safety net in Travis County. We're excited about it getting here. It's been a few years, and we think it's really going to do a lot for patients as we look for new ways to access supplemental payments in a way to help sustain and bolster the safety net in an even more meaningful way. And so for that, we're very grateful not only to you, but to Senator Watson and the House delegation, Governor Abbott for signing the bill. We're letting it become law. This is a perfect example of government working together with the non-governmental sector and the state leadership and doing something really good for the community. And for Mike, thank you for your leadership and anything that we can do to be supportive in this process. You can count on us to be there. Thank you.
Thank you.
Our last speaker for our public hearing is Kate Garza with Ascension Seton.
Good evening. My name is Kate Garza. I'm the Director of Advocacy for Ascension Seton. I'm here tonight to say we appreciate the county recognizing that healthcare has transformed and consolidated. There's a need to recognize the entire system of hospitals. We value our relationships with St. David's, with Baylor Scott and White, and the other hospitals that serve the Travis County community. We support the LPPF rate and appreciate the public-private partnership to maximize reimbursement for the care and the poor and the vulnerable in our community. We have invested in our network of hospitals, including the new teaching hospital, new clinical programs, and Ascension Connect that serve our community, and the Travis County LPPF will help us continue to serve our mission and provide high-quality care for all. Thank you.
Thank you.
That concludes our public hearing for tonight.
Thank you all for coming. Your feedback is important to us and will be considered by the board and discussed prior to the adoption of the mandatory payment rate and permissible uses of revenue by the Central Health Board of Managers. I'm now ready to, you're going to read it first, Mike? Okay. I'm now ready to accept the motion to close the second public hearing.
This is just a mistake on our part. It's the first and
First,
final
I'm sorry.
public hearing.
Sorry about that.
I
First,
move-
the first public hearing.
I move that we close the first public hearing.
Second, the only public hearing. Second.
All right, so I have a motion on the floor by Manager Greenberg, seconded by Manager Valdez. All in favor, any discussion? All in favor, say aye.
Aye.
Any against? Any, all, motion passes. All right, Board of Managers meeting. At this time, we'll close the public hearing of the Central Health Board of Managers regarding the local provider participation fund at 5:39 and convene the meeting of the Central Health Board of Managers for our board meeting agenda. The first item on the agenda is citizen communications.
Hi again. We do have one person signed up for Citizens Communication, so I'm going to introduce Stephanie McDonald with Central Health.
I would like to introduce you all to Brianna Yanis formally. I know that Brianna's been here for over a month, but this happens to be the first board meeting since she's arrived. She's really excited about it. And Brianna is joining us as the board governance manager. It's a kind of different, a little bit different position than maybe you've been used to having on the team in the past. Brianna is a native of Austin. She's a graduate of St. Edward's University, and she most recently worked at the Secretary of State's office. And she will be working with you and Emily in serving the board, primarily around getting the agendas and making sure that the meetings are scheduled, quorums, so you'll be hearing a lot from Brianna. I do also want to point out that Brianna has the distinct responsibility for organizing and administrating our public information response program, which is a lot of work on occasion, and I think she's getting a good dose of all the intricacies related there. I wanted to thank Emily for all of the hard work that she's provided. This is not Emily going away at all, but I think just another person on the team to help us. So welcome, Brianna.
And that concludes citizens' communication for tonight.
Thank you. Okay, I'd like to note for the record that agenda items 5, 6, 8, and 9 will not be discussed this evening. Those items are 5, discuss and take appropriate action on the healthcare service delivery expansion in Eastern Travis County, including the project budgets and project timelines. 6, discuss the 1115 medical aid waiver delivery system reform incentive payment projects, DSRIP, the Community Care Collaborative, including healthcare delivery arrangements and other interrelated community partnerships. 8, discuss and take appropriate action on the Central Health owned or occupied real property or potential property for acquisition or lease, including the downtown campus and properties located in Eastern Travis County. 9, receive and discuss a report from the President and CEO on Central Health operations and current activities, including A, the fiscal year 2019 strategic work plan and operational priorities, B, an assessment of systems and processes, and C, other personnel matters. I also like to note for the record that agenda item 1 will be taken out of order. It will follow agenda item 3. Okay, consent agenda item. C1, approve the following minutes for the June 19, 2019 meeting of the Central Health Board of Managers. B, June 19, 2019 special meeting of the Central Health Board of Managers. C, May 29, 2019 special meeting of the Central Health Board of Managers. D, May 21st, 2019 meeting of the Central Health Board of Ad Hoc Bylaws Committee. E, May 10th, 2019 meeting of the Central Health Ad Hoc Bylaws Committee. And F, April 24th, 2019 meeting of the Central Health Board of Managers. C2, receive a report of the June 2019 financial statement for Central Health as presented to the Budget and Finance Committee. C3, receive a report of the June 2019 financial statement for the Community Care Collaborative as presented to the Budget and Finance Committee. C4, receive the quarterly investment report and ratify Central Health investments for June 2019. C5, approve the award of a contract in the amount not to exceed $35,000 for external auditing services to Maxwell, Locke, and Ritter, LLP, as recommended by the Budget and Finance Committee.
Move adoption of items number C1 through C5 of the consent agenda item, consent agenda.
So we have a motion on the floor by Manager Valdez, seconded by Manager Greenberg. Any discussion? Seeing none, all in favor say aye.
Aye.
All against say no. Okay. Manager Jones is abstaining? Or are you saying no, Manager? Abstaining. Okay. All right. Motion passes. Regular agenda. Number 2, discuss and take appropriate action on the resolution settling the mandatory payment to be assessed on the net patient revenue of each institutional healthcare provider located within the boundaries of Travis County during fiscal year 2019 in conjunction with the healthcare provider participation program previously authorized by Central Health, specifically allowable uses of the revenue generated from these payments, designating a depository bank for the local provider participation fund created and administered by Central Health, and delegating authority to administer the program to the President and CEO. Katie and Jeff.
Yes, thank you very much. This agenda item relates to the adoption of the resolution that will set the payment rate for the LPPF program. And so I'd like you to direct your attention to what was in your packet for agenda item 2. A brief overview of the resolution, actually, Dr. Zamora just read. It does 4 things: delegates the authority to administer the program to the CEO, designates J.P. Morgan Chase Bank as the depository bank for the LPPF fund, and it sets the mandatory payment rate to be assessed against the institutional healthcare providers within Travis County at 1.11% of the net patient revenue. Net patient revenue determined, or the data source for that is the Medicare cost report, and 1.1% will generate about $35 million, as I said before. Finally, the resolution will direct us that the mandatory payment revenue be deposited into this bank and used for the purposes set forth in the legislation, the supplemental payments. So we've also included in your packet a draft copy of rules and procedures by which the CEO will administer the program. We are still working out the fine-tuned details there, but wanted to share what we can with you on those. And with that, I'm happy to take any questions.
I do.
Oh, yes.
Go ahead.
Well, I was just going
go.
to respond to your question from the Budget and Finance Committee last night. Included in your memo last week is a list of FY19 approved rates for other LPPFs across the state. It starts on page 2 of the memo, and you can refer to that and compare the rate we'll be setting tonight with what other communities have done.
Okay, thank you, I appreciate that. But the question I was gonna ask was whether or not, I don't remember if I'm suffering from Alzheimer's disease. And didn't remember if I heard a response to this question, and that is, if something were to happen to, I don't know, if this hospital may not have completed the project, whatever project or whatever that they were planning on doing, would we be, is there any situation rather that Central Health could be held liable for whatever was distributed to the hospitals? I don't know, under any scenario, I'm just asking, I'm just curious.
So, I'm not a practicing lawyer. I would say I cannot think of a scenario if that would be the case.
Okay,
But I'll defer over to legal counsel.
So I think your question is, in participating in the.
I'm participating in the
Healthcare Provider
LPPF.
Participation Program, if the hospital were to do something with the funds that the federal government found impermissible,
Correct.
would there be any liability for us? And that is something I think we should talk about in closed session. But off the top of my head, I would say I can't think of any either.
So is there a reason for us to go into executive session?
No.
Okay, thank you.
Thank you for taking it. You can ask that later. Any other questions? Mr. Jones?
Forgive my ignorance, I'm just trying to inquire. Do we have an estimate about how much this might yield?
About $35 million.
So the same amount we are providing to the University of Texas on an annual basis?
Is that right?
Yes. So this is for.
I know it's for two different things.
Yeah, it's
Yeah.
for
I'll-
participation
Have to do that
in the uncompensated care IGT that's coming up in, I'll just say the first half of September, because the date may change. And then participation in the Europe, we talked a little bit about the additional programs that we'd be able to participate in, which is a Medicaid enhanced supplemental program. So it would be for those, participation in those two IGTs, then we would plan on coming back to you. Don't know the exact timeline because we're waiting on information from the state, but we would come back, let's just say in October, November, possibly, to set the rate for the upcoming IGT requirements for the next year. Yes.
And per population, I mean, I've noticed when we rate up against, we're between Amarillo and, I guess this would be Garrison County, so I assume that that's an appropriate for what you think we should be able to do.
It is. We've evaluated in conversation with the hospitals, what the expected needs for those IGTs are for those programs, and this rate generates the appropriate amount of revenue to meet those needs for these two payments we're expecting. And other communities may have different math, the hospitals.
Yeah, that's what I was figuring, but this comparison is very helpful, so that's why.
Sure.
That's the only question.
Thank you, Andrew. Any other questions, managers?
One last one.
Manager Valdez?
Thank you. With respect to the various rates that are offered. Now, this is only per year. We're voting on this for this first year, correct?
Correct. This is for this initial payment.
Yes.
For this initial rate that you're setting, that is, that will be the amount that will cover those two program payments we just discussed. Then, as Jeff was saying, we'll come back for another round of rate setting for the next round of hospital payments that's needed.
Thank you very much. And the only reason I want to be clear on that is that I know that there are significant demographic changes occurring. Maybe more movement into these outlying counties that would be people or residents who would be receiving services in those hospitals. And at some point in time, there may be a need based on whatever future needs may be to adjust that rate up. And I just want to make sure that that's going to be an ability for a flexibility for us in the hospital districts to be able to work out in the future, correct?
It definitely will. Every time we set a rate, there will be a new negotiation, and you'll have input in what that rate looks like.
Thank you very much. That's it.
Any other questions? Mr. Giesel, would you mind reading the resolution?
A resolution setting the fiscal year 2019 rate for the Travis County Healthcare District Provider Participation Program and permissible uses of the funds generated by this rate. Whereas during the 86th regular session of the Texas Legislature, Senate Bill 1350 was enacted to add Chapter 298E to the Health and Safety Code. Chapter 298E enables the Travis County Healthcare District doing business as Central Health to authorize a local healthcare provider participation program. And whereas at the June 19, 2019 meeting of the Central Health Board of Managers, the board authorized Central Health to participate in a healthcare provider participation program, to collect mandatory payments from institutional healthcare providers, to create a local provider participation fund, hereinafter referred to as the Travis County Healthcare District LPPF, to hold the payments received and to use the funds held by the Travis County Healthcare District LPPF for the purposes specified in Section 298E of the Texas Health and Safety Code. And whereas pursuant to Section 298E of the Health and Safety Code, each year Central Health's board is required to hold a public hearing on the amounts of any mandatory payments that Central Health intends to assess against institutional healthcare providers within Travis County during the fiscal year, which begins on October 1st, and how the revenue derived from those payments is to be spent. And whereas Central Health's board held a public hearing on the 31st day of July 2019 to receive public comment on the proposed mandatory payment rate that Central Health intends to assess against institutional healthcare providers during fiscal year 2019, which is October 1, 2018 through September 30, 2019, and how the revenue derived from those payments is to be spent. Now therefore, be it resolved that the Board of Managers of Central Health, 1, authorizes the Chief Executive Officer of Central Health and the CEO's designees to take all actions deemed appropriate to implement and comply with the laws governing the Healthcare Provider Participation Program authorized by Chapter 298E, including but not limited to implementing Healthcare Provider Participation Program rules and procedures and entering into agreements on behalf of the Travis County Healthcare District LPPF. 2, designates J.P. Morgan Chase Bank, National Association, or NA, located at 221 West 6th Street, mail code TX3-8211, Austin, Texas 78701, as the depository bank for the Travis County Healthcare District LPPF. 3, sets the amount of the mandatory payments to be assessed against institutional healthcare providers within Travis County during fiscal year 2019 at 1.11% of the net patient revenue of each such institutional healthcare provider, and 4, directs that mandatory payment revenue be deposited into the depository bank for the Travis County Healthcare District LPPF and used for one or more of the purposes set forth in Section 298E of the Texas Health and Safety Code.
Thank you, Mr. Giesel. Can I hear a motion to adopt the resolution?
I move that the board adopt the resolution as read into the record by Mr. Giesling.
Second.
Okay, so I have a motion by Manager Greenberg, seconded by Dr. Mill. Any discussion? Manager Valdez.
With respect to us serving as a repository for hospitals' information, reports, Is that correct?
The board designates the depository bank or institution to receive the funds.
No, okay, I'm talking about the reports. Will there be an annual report?
The
Reports on the
rules-
uses of money,
Report on the uses of money.
yes.
The legislation requires the hospitals to provide us the report they already give to DSHS for their utilization and net patient revenue data that they already submit to the state. So they're required to give that to us.
Great, and is that going to be available for the public to see?
Yes, it's available for the public now, so yes.
Thank you.
Any other questions? Seeing none, all in favor?
Aye.
All against? Anyone abstaining? Motion passes. Thank you.
Thank you.
Thank you, Katie. Thank you, Jeff. Okay, agenda item 3, discuss and take appropriate action to amend the Travis County Healthcare District's investment and collateral policies and procedures, and to delegate authority to the president and CEO to take certain other actions necessary to implement the healthcare provider participation program. Mr. Knoll.
Thank you. So now that we have created the LPPF and we've established the bank that will hold the funds, we need to ensure two things. Any funds received, how might they be invested? And then the second piece would be related around collateralization. In your packet, there were copies of the existing Central Health investment policy with a few red lines of a few minor changes just for clarification, but more importantly, changes that incorporate the LPPF into the Central Health investment policy. So we think that related around the LPPF, we want to make sure that we have guidance on what authorized investments would be related to the funds and what the collateralization levels would be related to those funds. Simply put, the Central Health investment policy conforms to the Texas Public Funds Investment Act. It stresses safety of principal. It also stresses liquidity with a kind of third priority of rate of return. The LPPF may be slightly different. It may actually have competing high priorities for both safety of principal and liquidity, since there are high volumes of cash that will flow out periodically and potentially quickly. So with that, I would request the Central Health Board adopt the amended Central Health policy, investment policy related around holding funds for the LPPF.
Dr. Bell?
I move that the board adopt the revisions to the Travis County Healthcare District investment and collateral policies and procedures as presented by Central Health staff.
Do I hear a second?
Second.
So I have a motion by Dr. Bell, seconded by Manager Greenberg. Any discussion? Manager Valdez.
Thank you, Jeff. I don't have a problem with any of this except to ask one thing, and that is whether or not any of our budgeted amounts will have to be held in an account for this, I guess, for any reason, for any purpose. Will we have to hold any money?
So the LPPF will only
Have them.
hold
Their money?
payments that come
From
from
the
the
hospitals.
hospital.
Correct.
It'll be in a
Not
separate
ours.
account that's mandated by the legislation.
Just wanted to make sure. That's what I thought I understood the last week.
Yes.
I just want to make sure. Okay, thank you very much.
Manager Jones?
Just want to make sure in terms of it, I'll be honest, I've not read through all of this document here, so I'm not.
So some exciting stuff.
It is. But it speaks to the need to be able to accommodate what you're asking us to do, I guess is what I'm asking.
Yes.
It gives that flexibility to do that. And you're comfortable?
Yes, so it allows when the funds are received by Central Health, You could theoretically put it in a non-interest bearing account. We think from an administrator standpoint, that's not prudent use of the funds. We think adhering to the Central Health investment policy would be more prudent to allow some return on those funds. Again, from a safety perspective, making sure that we're properly collateralized in the event something were to happen. And when I say something that would happen, you really have collateral in the event of the bank folds that you have your money deposited in. The FDIC only funds a certain limit, I think up to about $250,000. We'll have substantially more than that in the account at times. So we want to ensure that it's properly collateralized in the event, the remote event that something would happen.
You're comfortable, this speaks to that then?
Yes.
Manager Reber?
Yes, and I think that's a very good idea, because the only other alternative you would have would be to break it up amongst many banks in chunks, so I think this is prudent.
Yeah, we couldn't do that.
No, exactly.
Any other questions? Seeing none, all in favor say aye.
Aye.
Aye. All against? Any abstentions? Motion passes. Thank you, Board. Thank you, Board. Thank you, Jeff.
Thank you.
All right. Agenda item 1, receive and discuss a presentation on the proposed Central Health and Community Care Collaborative fiscal year 2020 budget, including the fiscal year 2019 end-of-year estimates and ongoing budget strategies. Mr. Knoble, Ms. Owens, and Mr. Morgan will be presenting. Thank you all.
Thank you. This is a real numbers-based presentation. We had an overview last week at Budget Finance Committee. We are presenting the budget. This is informational only. We are not requesting any action. And I think at some point we end up rolling out the calendar that shows the number of events that we'll have during the budget setting process. But again, just to stress that this is a proposed budget. I fully expect there to be changes in the budget process. It's just a proposed budget. We know that we've set a tax rate. Minimally speaking, numbers will change when we receive the certified tax roll from the appraisal district. So anyway, just to let everyone know, this is the first of a number of meetings that we'll have to discuss both the Central Health and the Community Care Collaborative fiscal year 20 budget. So looking at when preparing the fiscal year 20 budget, there were some key issues related around our strategic plan that were considered during the preparation of the budget related to our fiscal year 19 through 24 strategic plan objectives. Develop and execute healthcare delivery based on people in place. In fiscal year 2020, Central Health will continue to focus on improving access in strategic locations and through new delivery models with a focus on southeastern Travis County and other priority areas. Although the majority of people experiencing low income in Travis County still reside within close proximity to the I-35 corridor, the rising cost of housing is pushing more and more of Central Health's target population to rural and suburban areas of the county. In fiscal year 2020, Central Health may develop as many as 3 clinic locations in priority areas, including Hornsby Bend, Austin's Colony, Del Valley, and Colony Park. The second strategy related around implement patient focus and coordinated health care. Central Health will improve access through technology enhancements. One enhancement includes improving specialty care through an e-consult and specialty referral platform that allows primary doctors to consult with specialists when appropriate. This technology will speed up interventions versus the traditional referral model and prioritize face-to-face specialist visits for patients who require a higher level of care. Central Health is also improving its eligibility and enrollment services with the expansion of MAP Basic, contracts with additional rheumatology, podiatry, nephrology, wound care, and general surgery providers, and improvements in medical management. And then last is sustainable healthcare financial models. Central Health will work throughout the year to manage financial risk and maintain sufficient reserves to ensure work continues to increase access to improve health outcomes and reduce health disparities among its patient population. For fiscal year 2020, Central Health is negotiating with its hospital partner Seton to change its payment structure to a claims-based direct payment model. This model offers advantages over the current indirect payment model, including greater transparency, what hospital services are being paid for, the transition of specialty services to more appropriate clinic settings, and the ability to utilize performance metrics and incentives to improve service and population health outcomes. So fiscal year 2020 is, I think we started out our forecast as calling it a year of change, and there are a lot of changes related to healthcare financing. Regulations have changed as it relates to how uncompensated care pays hospitals for unreimbursed costs that they incur for providing services to and underinsured patients. Just to recollect, uncompensated care is a part of the 1115 waiver, and Central Health has historically provided the local share of funds referred to as intergovernmental transfers that draw federal funding to pay hospitals for the care they provide. Central Health was able to direct the local funds that made up the IGT to specifically designated hospitals. Beginning October 1st, local funds will not be directed to specific hospitals, but instead will be pooled and distributed to all eligible hospitals across the 8-county Medicaid service delivery area. That includes Travis County. Central Health also successfully passed legislation this year, as did a number of Texas hospital districts, of authority to establish a local provider participation fund, or LPPF, which we just approved, and thank you again for your support on that. The LPPF receives payments from hospitals and will provide the local funding for uncompensated care. The LPPF structure has been approved as a funding structure by CMS, and that carries a lot of weight regarding with us regarding that structure. In addition, the LPPF will provide intergovernmental transfers for a hospital program called URUP, which stands for Uniform Hospital Rate Increase Program, which provides additional supplemental payments for Medicaid rates. In the past, Central Health has not had the financial capacity to participate in the URUP fund. Overall, the LPPF will be capable of bringing more funding into the local healthcare system and prevent potential dilution of Central Health local tax dollars. Another potential change that I alluded to in the previous slide is the way that Central Health pays for hospital services. Currently, Central Health pays for hospital services indirectly through uncompensated care and disproportionate share of funds. For fiscal year 2020, Central Health is actively negotiating with Seton to change the manner of how we pay them to a more of a claim-based direct payment model. This model offers advantages over the indirect model, including better transparency related to hospital services provided, easier transition of specialty services to more appropriate clinic settings, and the ability to utilize performance metrics and incentives to improve service and population health outcomes. Just again to stress for people that are watching, Central Health is negotiating with Seton, and it remains to be seen if we're able to negotiate moving forward in this direct payment model. Proposed changes related to our fiscal year 2020 budget. We're going to present tonight both the Central Health and the Community Care Collaborative proposed budget. Just quickly, some of the changes that you will see that you may have seen in previous years that will be different. On intergovernmental transfers, disproportionate share, and the Community Care Collaborative, DESRIP, IGT, is what you will see budgeted in fiscal year 2020 in the Central Health budget. Also in the Central Health budget, there will be funding for a majority of healthcare delivery costs that were previously budgeted in the Community Care Collaborative. And then we also talked about the negotiation of a direct payment model for hospital services. We have prepared a budget. It's a placeholder. There's still a lot of terms that need to be worked out. It hasn't been conducive with our budget process. Sometimes that happens, but we have budgeted a placeholder, and hopefully as we progress in negotiations, we'll be able to refine that during the budget process. On the Community Care Collaborative, you'll see a budget for DESRIP revenue and DESRIP project cost. You'll see the affiliation payment that we have related to the Dell Medical School and University of Texas at Austin. And then you will see some limited healthcare delivery costs. So with that, I'm going to turn it over to Lisa to begin the Central Health proposed budget presentation.
Okay, thank you. All right, so a few of these we talked about last week at the Budget and Finance Committee, but I would just highlight again, the starting point for preparing the budget was in the 7-year forecast, the direction to start with a 6.3% over the effective rate. So an important component of that is the taxable assessed values and proposed rate. This year, we continue to see growth in the Travis County real estate. We have over approximately $208 billion in assessed values in Travis County. So you'll see that going up, continuing to go up. That is about a $20 billion increase over last year, with about $5 billion of that being new construction. So as a result, the calculated rate that is proposed does start to go down a little bit as those assessed values bring additional tax dollars into our budget. So we did update the 7-year forecast with additional information. So although the trends don't change significantly, we did put in a current year estimate, which I'll walk through in the next slide, as well as what our proposed budget is for FY20. And it still shows that at 6.3% over effective, we do have a dip into our reserves, but that we start to see that recovery and start to see that structural balance in 2026. And as again, our indicator being the days of cash on hand starts to rise back up towards that goal of 100 days of cash on hand. So here's a first look at a draft proposed tax rate. Again, I think we've mentioned this, but until we get the certified roll from the Travis Central Appraisal District, most of this is draft, but it's a good start. At 6.3% over the effective rate, the proposed rate would be about 10.4503 cents per $100 of valuation. We continue to have a small debt service rate, and we've compared the average taxable homestead value in Travis County year over year, and you'll see that tax rate does go down a little bit. However, the annual increase to the taxpayer who has an average taxable homestead value of $348,000 this year would be about $20 annually. I also like to remind you that we have the highest allowable by law homestead exemption, which is 20%, and we have $85,500 homestead exemption for over 65 and disabled. So for your reference, here's a first look. We like to prepare the taxpayer impact based on the bands. So again, these are large $100,000 bands, averages, with the average home value appreciation at that band. And it shows you a comparison at last year's rate with the average value going up for that band. And I'll focus on the first row, the $150,000 from last year. The tax bill would have been estimated to be about $127. That band of value went up about 7% this year. And so the estimated tax with our proposed rate, and again, we're not setting the rate or anything tonight, we're just at a starting point, would have an annual impact of about $8. So we'll continue to update this as we get the final numbers, but this is just a good look at the different impacts as the home values go up. So the first part of our proposed budget is to estimate where we believe we will end up September 30th of this year. As you know, we have a contingency reserve for healthcare delivery that we carry forward into the next year, and we also maintain an emergency reserve, which is at about $32 million right now. So if you look at the second column here, I'll just walk through our estimate. We do estimate to be a little higher in our sources of funds this year at $269 million. And that will carry forward as we estimate the uses. Our uses we anticipate being less than budgeted at about $211 million. So at the bottom you'll see the estimated contingency reserve at the end of the year, September 30th, would be about $57.8 million. Again, as we get closer to the end of the year, if we have additional information, that could be updated. But that allows us to bring forward into the 2020 budget as a source of funds these contingency reserve dollars for healthcare services and delivery. So on this slide, I'd like to focus on the sources of funds. We have just a few sources of funds, as you know: tax dollars, lease revenue, and then other revenue, which is mostly interest and tobacco. So you'll see an increase of about $17 million in tax revenue estimated next year from the 6.3 over effective. Again, as we get final numbers, that could change a little bit. We also estimate that lease revenue will go down a little bit. This year there were some drivers in one of our new leases that we don't anticipate next year. And then other revenue, again, tobacco and interest at about just under $6 million. So we estimate at this point in our proposed budget that we would have $291.5 million sources of funds as we go into a draft budget. And I'm going to talk more about the uses on the additional slides. But the uses of funds would be for healthcare delivery estimated at $279 million and just over $12 million for administration and tax collection. Again, a very low percentage of the total. So looking at the details on the healthcare delivery, which is our largest use of funds, we have estimated, as Jeff talked about, 2 IGT programs being funded by Central Health, DISH, Disproportionate Share Program, and then the CCC DISRIP. So estimated just under $55 million in IGT for next year. A member payment for the CCC, we do not anticipate a budget in that line item. However, we will be directly contracting, as Jeff talked about, for primary care, specialty care, and hospital services. So you'll see a lot more detail in our proposed budget in those areas. And I'm going to turn it over to John in just a second to talk a little bit more about that. But there would be direct contracts continued in Central Health in those areas. Further down, you'll see we continue to invest in our reproductive and sexual health programs. at about $2 million, and additional funds for the Pay for Success Permanent Supportive Housing Project that was approved, and primary and specialty care reserves of about $2 million. And those are service expansion funds. Those are reserves for primary and specialty care dollars that may be needed to expand services. So I'm going to turn it over to, the mobile. So the primary care, the mobile health clinic last year, we did budget for those expenses. That mobile was purchased. It is actively out there. So we don't anticipate an additional investment in mobile. However, the operating costs are part of the ongoing budget in primary care.
Thank you, Lisa. Managers, thank you for the opportunity to speak with you tonight, and thank you for bearing with us. This is a pretty complex budget and a lot of things changing over a short period of time. I'll keep my comments very brief. We spoke at length last week about some of the accomplishments of the enterprise over the course of FY19, and also highlighting some of the initiatives and changes going into FY20. So tonight I'll just point out a few things on the slide and really try to focus in on where some of those changes and initiatives show up in the FY20 budget. As Jeff and Lisa both mentioned, starting in October, Central Health will directly contract for a substantial portion of the healthcare delivery services, including a large portion of the primary care services that we offer, as well as the specialty care services, as Lisa mentioned. The post-acute line, post-acute care line item that you see on this slide really represents the continued commitment to build out that continuum of care that consists of our skilled nursing facility services, our home health, hospice services, and some of the services that specifically serve our homeless population in recuperative care and medical respite. Pharmacy is not something that we talk a lot about, but I would like to take just a moment to talk about that. It's a very significant part of what we do here, and part of the program that we offer to the patients that we serve. Just to give you a few statistics to highlight that, we anticipate filling around 400,000 scripts over the course of the year. It's a substantial program consisting of a large network of available pharmacies for our patients. And this is part of the restructuring of making sure that we're taking a deliberate approach to how we manage our pharmacy program, maximize programs like 340B and the Patient Assistance Program. And I'll just highlight the patient assistance services that Community Care offers to our patients on an annual basis that returns about 6,500 high-cost medications to us, to equate to about $9 million of savings to the system annually. So we're really trying to pay close attention to pharmacy. You all know that that's a big part of the MAP Basic expansion, and we just want to make the best use of those dollars and make sure that the drugs, the access to those drugs is available to our patients. We can go from there.
Okay.
Yeah, so our budget also includes funding related to Sendero. We have 6 months of data available related to 2019. Again, keeping in mind that Sendero is on a calendar year. Related around that actuarial data, we have 3 things that we think we know. One, the patients, and we moved about 223 patients to Sendero. The patients moved to Sendero have incurred higher costs than anticipated. Second, Sendero has a broader network of specialists that are available to care for these very sick patients. And third, despite the higher cost, the overall strategy has had a positive impact on Sendero finances. So looking into fiscal year 2020, the proposed budget will include continuation of the Premium Assistance Fund for high acuity chronically ill patients. But again, and I just want to pause for a second, this is a strategy that was related to our performance review, and it's related around the risk adjustment. There are lots of changes going on in the ACA that we'll continue to be monitoring. And secondly, it's taking on the more patients that you bring into the program, potentially the more volatility or the more risk that you may be bringing in to this program. So I know there's a lot of discussion related around funding of Sendero, and I'm sure we'll have an extended presentation and session tonight to discuss it. But I just wanted to point out that it is included in the budget as a placeholder.
Okay, thank you. So you'll see on this slide, at the very top in the 2020 proposed budget that ACA healthcare premium assistance programs, that 9.251 million that is budgeted does include what Jeff referred to as the Sendero High Risk Plan, as well as the CHAP program, and in addition, the ACA education enrollment. I have a little more information on the next slide on healthcare facilities and financing, which is our campus and redevelopment. You'll see a decrease in that budget as we anticipate the operating costs to be going down significantly and the development costs to be continuing to have development costs there. Further down, salary and fringe benefits, legal consulting, all the way down to our other operating expenses. Those are the departments that are funded in healthcare delivery and central health. And in addition to the direct services, the direct contracts for services that John talked about, Central Health will also directly provide some of the existing functions that are currently in the CCC. So you'll see an increase in that budget in FY20. Subtotal here, as we look at the bottom in these areas, and again, it's subtotals from the previous slides, $228 million in healthcare delivery, which is about a $20 million increase in our budget this year. Just a little bit of a highlight on what I just talked about, which is the operations of the campus decreasing as we have the demolition hoping to begin this summer, and then continued investment of about $5 million in infrastructure and development, which is continuing to develop the existing components of the campus. So in addition to direct services and IGT and our operations and support of healthcare delivery programs of $228 million, we also, in our uses of funds, outline our transfers to the capital reserve and emergency reserve, as well as a contingency reserve appropriation for healthcare delivery that you'll see here that is estimated to be about $43 million for future healthcare delivery. We also have our debt service, which is just under $1.4 million, and again, that's on our debt, our CO bonds that we have outstanding. So total healthcare delivery is $819,000 as we look at our first proposed budget, and a significant increase over the prior year. To just hit a few highlights on administration and tax collection, you will see increase in our administration expenses this year. Again, the operating expenses are outlined in categories in the budget, and you'll see an increase in most areas. As we've talked about the Germain report over the past several years, we have made some investments in this fiscal year as well as in 2020 in our administration departments. However, we still maintain a very low percentage of our overall budget in administration. So total estimated administration in the budget for 2020 is at $10.8 million, and tax collection expenses at about just under $1.9 million. So total of all of our uses, which equals all of our sources, of $291.5 million in the first draft of the budget. We've talked in detail about the long-term capital improvements last week, and I just brought back this slide to talk about what's in the capital estimates for this year. We do anticipate opening balance in our reserves of just under $4 million, and some potential capital expenses that Jeff talked about earlier, potentially 2 to 3 clinic locations in Travis County, And without having the details of those specific projects, we did put some high-level estimates in that would have possible debt financing and some additional reserves required. So those are the highlights of the central health budget. I'm going to turn it over to John now to talk specifically about the community care collaborative budget.
So this is a slight shift from the central health budget to the community care collaborative budget. As Jeff mentioned at the beginning, there are a few main things that you'll see in the CCC budget going into FY20, and I would reiterate that this is all obviously subject to change over the course of the budget discussions over the next couple of months. The main things you're going to see in the CCC budget again are the DSRIP program, both payments and costs associated with that program, the remaining healthcare delivery contracts and services that we provide through the CCC today, as well as the University of Texas Affiliation Agreement payment. We expect to end fiscal year 19, the current year, with approximately $138 million in total sources against our anticipated budget of $142 million. In FY20, we anticipate about $62 million in DSRIP revenue associated with our performance in that program, as well as about $5 million that will carry forward from our ending balance in FY19. That'll give us a total amount of sources in the CCC budget next year of about $67.17 million. For uses in the CCC for FY20, this certainly looks substantially different than our current year budget based on those available, the anticipated available revenue in the CCC. The uses will consist of some of the existing smaller primary care agreements that are there today. The urgent care and convenient care budget is actually slightly larger. I think last week I mentioned one of our planned expansions to the MAP Basic program would be adding the urgent convenient care benefit. And this slightly larger budget anticipates that addition over the course of the year. Select specialty care services would remain in the CCC, as well as the existing post-acute network agreements. There are a few healthcare delivery operations and administrative expenses that will be in the CCC next year at approximately $2.4 million, and then an operations contingency of $2 million, or slightly over $2 million. We also mentioned the DSRIP project costs at about $12 million, and the UT affiliation agreement payment of $35 million. Again, taking our total uses as a balanced budget to just over $67 million.
Okay, so what's next? A lot more meetings. Thanks for your flexibility. I think we're going to be holding a few more Wednesdays on your calendars. But we have updated the calendar. I just want to go to the second page of the calendar. Oops, went too far. To August 28th, where we do anticipate having pushed back a little bit our vote on the maximum tax rate, which would start the public hearing process. And so we will be asking to hold that Wednesday. And as I mentioned, I believe last week, as the appraised values are certified, we'll be able to start the setting of the tax rate. However, we do anticipate still potentially, although we're going to try to do our best to work as quickly as we can, potentially having to approve the budget in advance of October 1st and approve the tax rate after October 1st, just due to the calendars and the need to have this board approve and the Travis County Commissioners. So the current estimate of those dates is up there now, but subject to change. So with that, we can answer any questions.
Yeah, I would like to just quickly thank staff that has worked really hard. We have a staff that works really hard, and there have been a lot of changes. They've been putting a lot of hours in, and thank you for your patience as we go through the process again, acknowledging there are a lot of changes, but thank you for your support. And if we don't know the answer to any of your questions, we'll certainly try to get back with you as soon as we can related to those questions. But thank you.
Andrews, all those?
I just have one question, because I'm not gonna ask any more. Because I know this is a flexible, this is the beginning, I can continue to ask questions later. But I do wanna ask whether or not it would be possible to meet with you, outside of this, meeting to talk about some specific questions that I have with respect to, disaggregating some of the costs that have been lumped together.
As per central health policy, let's go through Mr. Giesman or.
No,
or-
I know,
So,
which I always do. So I'd just like to know if you all would be amenable, and Mike, I'll shoot you an email to make it formal, but normally I call Emily. Okay, if that would be okay. Otherwise, I'll start asking questions.
Right, understood. So we'll set something up, but we'll try to, but in light of quorum requirements, see what other members might have questions, and I'm sitting there thinking if there's a way that we could consolidate some of these and even get them in writing in light of some of the absences, so that way we can disseminate the information out. So we'll provide a couple of different channels for you to meet with staff and also get answers to
Do
your
you want me to
questions.
just give you shoot you some general kinds of questions so that,
No, I don't,
Or
I mean,
not?
as long as it pertains to the budget, I don't think that's necessary. Just-
Okay,
but just-
it
yeah,
all
just work
pertains to
through
the
Emily
budget.
And we'll get something set up.
except for one thing, it all pertains to the budget, but one last thing. What would 6.5% give us with respect to, how much more money would that give us? That's all.
So just doing math in my head,
I
that's
know,
gonna be about
because I'm not-
$400,000. So we get about $2 million for every percentage. So you're increasing it by 0.2%.
Okay,
So I think it would be about $400,000.
about 400,000, and that's, okay, so 7% would be,
I mean, we'd be glad to provide some tables for you
Yeah.
if you'd like to see that.
yeah, please,
Okay, thank you.
thank you.
Ms. Jones?
A couple of quick questions. One is, we had community engagement in one of your line items, 350,000, I think it was. Mike, can you give us an update on where we are with our community engagement efforts that occur, of this year, this current year? Because I know part of the efforts we were looking at is trying to get people out and discussing what we're doing. So can you give?
Let my vice chair speak to that.
I'm sure Mr. Giesen addressed, but I would also add that at our strategic planning committee meeting, Mr. Burton is going to give us a robust update on all of that, and that's coming up next week.
Yes.
So Manager Jones, just to make sure I'm understanding your question, I mean, that's a
Yeah.
lot of work, and actually I would need to bring Ted up to fill that in, but is there something specific about the community engagement?
I know that particularly in the Eastern Crescent, we were talking about getting a contract, I think it was, to be able to do some community outreach efforts. And that, I thought we were waiting to do something, I don't know.
I'm
what we-
advised that, well, let me think about where this sits on the agenda, Counselor.
Just want to know when the community will have their chance to hear about the budget you're presenting tonight.
No,
No,
No.
Just with respect to community engagement
yeah,
efforts.
that's what-
So, as it relates to this fiscal year, and potentially in the next fiscal year, we have funds available to do the community outreach that you suggested. I'm advised that there's a contract actually forthcoming for my signature
Okay, so,
to be able
yeah,
to.
that's what I was trying to find. Do we have a time frame of when it might be?
Is this something that I think Mr. Burton will address in great detail next
Okay.
week, where it's posted on the strategic planning committee? Is that correct, Holly? Yes.
Next week?
Yes.
The question, reason I raised it is we've been discussing this outreach for quite some time and keep saying we're going to get it, we're going to get it, we're going to get it, we still haven't got it. So that's why I was trying to go with that.
That's why we're having the updated strategic planning on this
Okay.
next week.
Okay, and the second question, this is going to be sort of a humorous one, I think, is, has anyone ever called us and asked, where is, on our line item, I have this Travis County Healthcare District, and it's always the smallest amount on my, and I want to thank you all for being able to keep our taxes low. I mean, have you ever gotten any kind of inquiries about the money that we get from the taxpayers with regards to, compares to the other entities that are taxing authorities?
No, I've never received a call like that.
Have you gotten a complaint about it? I guess.
No, no, we actually, and we'll try to update as we get information, but Just as it relates to all the taxing jurisdictions in Travis County, you know, we're typically around 4.5% of the total tax burden. And then, again, as we compare our tax rate to other hospital district rates, you know, we sit, let's just say, somewhere around 10.5 cents. The general tax rate range of the other hospital districts is anywhere from 17 cents to 27 cents. So, and that doesn't take into account valuation, you know, average values in those jurisdictions, but just from a tax rate perspective, we're at the lower end.
Well, the reason I ask that is because when I'm out in settings and speaking, I always allude to the fact that people say, well, what do you all do and what do you operate? I say, do you remember that on your tax statement, that item that talks about healthcare district? Oh, that's who you are.
Yes.
So I say that jokingly, but to emphasize to those who are listening and others that this is where we get our resources from. You pay for those, and this is where it shows up. And I think that's important because everyone doesn't understand that they just pay their bill and say, I paid it, but they don't always understand where it goes to. And I think it's important that they understand that we're probably the smallest, but we do a lot with the amount we get. So I just want to compliment you on the work you're doing and let the public know that, you know, that little line item speaks to that.
Thank you.
Thanks. That's it.
And you're right, Manager Jones, that our staff, our executive management team, and this board is very frugal. You know, we know that we're stewards of the taxpayers, and we're trying to use everything we can get to serve as many of those that are most needy out there, our most vulnerable patients. Again, as you, I'm sure, are thanking Manager Jones, I'm sure you're thanking her staff. I too want to thank our staff, Jeff and Lisa and John, Max, Mike, and everyone. Any other questions? Seeing none, this is an informational item only.
Thank you.
Okay, agenda item 4, discuss and take appropriate action to appoint directors to the Board of Sendero Health Plans, Inc. Mr. Giesland.
Yes, members, there is a memo in your packet regarding the reappointment of members to the Sendero Board of Directors, and I won't go through that memo line by line. But just to sum it up, you know, given the environment that we're operating in and the Affordable Care Act marketplace, I think at this point in time it is prudent to reappoint the board members to the Sendero Board of Directors, and that would be as follows. So it'd be Dr. Charles Bell, Larry Wallace, and Jeff Canola for 2-year terms ending October 1, 2021, and Juan Garza, Carl Ritchie, and Lynn Hudson for 2-year terms ending January 15, 2022. And in this manner, what we do is we maintain the stable and very capable leadership. And, you know, thank you to Dr. Bell and Jeff, and I think Larry was here earlier, those that serve on the board. But at the same time, you know, and given the earlier conversation that we have, you know, keeping an eye on, you know, who else is out there, you know, should there ever become a vacancy, and we need to obviously fill a board position. So with that, I'll put this before the board, and I recommend that we appoint the members as so named to the Sendero Board.
Manager Valdez?
I move that the board reappoint the following members. Do we have to state it as they were included in what was cited by? Okay.
Yeah, for the record.
To Board of Sendero, and I'm hoping that this is with the approval of their CEO. Dr. Charles Bell, Larry Wallace, and Jeff Canola for 2-year terms ending October 1st, 2021, and Juan Garza, Carl Ritchie, and Lynn Hudson for 2-year terms ending January 15th, 2022.
Do I hear a second?
Second.
Okay. So I have a motion on the floor by Manager Valdez, seconded by Manager Jones. Any discussion? Seeing none, all in favor say aye. Aye. All against? Any abstentions? Motion passes. Okay. We'll let the record show that Manager Bell is going to abstain. Manager Bell, thank you, and all the other people on the board, thank you all for service, your service. All right, agenda item 7, discuss and take appropriate action on an update regarding Sendero Health Plans, Inc. including the effects of federal legislative and regulatory action. Mr. Kowski.
Take a,
Sure. Do you want to?
well, going to closed session?
Sure, when we take over.
Okay, we'll take a break then.
You need to say something?
I think there are maybe two questions. One is, are we gonna go right into closed session? And two is, can we take a break to satisfy maybe some personal matters?
Exactly.
And so, I would recommend you take a break before we actually know we're going into closed session.
Okay.
But is Wes going to present first, or are we going to just go?
We're gonna go right
Into closed
Okay,
session,
all
so
right.
we're gonna take a break, yeah.
All right, so you ready to go ahead and ask for,
break.
right, okay. All right, we're going to recess for 5 minutes. Is there food next door? There's food next door, guys.
You were here earlier, y'all were in the meeting.
It is July 31st, 2019. It is 7:50. We're coming out of executive session. No action will be taken on item number 7. It's an informational item only. All right, agenda item 10, confirm the next regular board meeting date, time, and location. The next Central Health Board of Managers meeting will be held on August 21st, 2019, at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. With that, I'll take it.
I move adjournment.
All in favor, say aye.
Aye.
All right, let's go home, guys.
So we're moving back the public hearing from the 21st, because it was originally scheduled for the 21st, wasn't it? Or 23rd, moving to the 28th. Is that what I saw?
Pull it up again, real quick.